Black and Latinx communities have been significantly plagued for a long time by health inequities. We have life expectancy gaps, in some instances between Black and white Chicagoans of 10 to 12 years or more, depending on the neighborhood. We don't have enough of our people of color really connected up to care, healthcare, having a regular relationship with a physician or a nurse practitioner. And so those are some of the challenges that we face. And as you know, this virus exploits people who have underlying healthcare conditions, and that is true across Black and brown Chicago. And I'll just dig down into one of the things that I said before. When we found out in early April of 2020, that this disease was disproportionately impacting Black and brown Chicago, I said to my team at that time, we need to dig into this. We can't look away, but we also can't do temporary Band-Aid solutions. And so we formed this racial equity rapid response team that partners us up with community healthcare organizations that had already been working on a number of these issues. We followed the data and really surged resources and outreach into areas where we're seeing the highest mortality rates, the highest rate of infections. We opened that table up later to address the Latinx community's challenges through COVID. And we have now formed a network and a partnership across the city that has served us well as we've been dealing with vaccine rollout. Vaccine hesitancy is also high. The same people who are getting the sickness are the most at risk. We found through our surveys were the least likely to be willing to take the vaccine. We've turned these numbers around. Go ahead, jump in. It was important. People wanted to understand, they wanted data, they wanted to be able to really